Joining us now, infectious disease specialist and ABC News contributor, Dr. Simone Wildes. Thank you so much for joining us.
Thanks for having me.
So first off, Doctor, incredibly promising news today out of Oxford. Scientists there say that they have identified what they're calling the first drug proven to reduce coronavirus-related deaths. It's a low-cost steroid called dexamethasone. Break this down for us. I mean, what type of COVID patient might this drug help? And could this be a real breakthrough?
So this is exciting news that came out today. Dexamethasone is a steroid drug that can be used. Normally, we've seen it used in patients with arthritis. Some patients that have had some cancer, they use it. But what they have done in the study, they have done what's called the recovery trial. It's a randomized clinical trial trying to figure out what are some of the potential treatments for COVID-19. And what they have found is that this drug in patients that are severely ill, those that are requiring a ventilator to help them breathe, and those that need oxygen, that there has been benefit in taking this drug, that their death rate has been decreased by a fifth in those that are on the ventilator, and by a third those patients that are on oxygen. But the key thing to point out is that this drug is not used for patients that are not requiring oxygen or for patients that are outside the hospital. So it's good news. I know the data has not been released to everyone. This is just preliminary data, but I'm definitely excited about what this has to offer for our patients.
And how widely available is this drug? And what would you say are the next steps here? Will doctors start using it on a trial basis here in the U.S.?
I think just given the information that we have so far, definitely we're going to be using it more in our patients in the hospital because of the positive results. And, you know, it's going to be available worldwide. It's low cost. It's a generic drug. So definitely should be something that most people will have access to.
And taking a step back for a second, could this drug significantly reduce deaths? And are we closer to where this is treatable ahead of a vaccine?
I think every step we make gets us closer to finding out more about how we can treat COVID-19. So definitely a step in the right direction. I think there's still more steps that need to be done, or other drugs that we're evaluating. And of course, we're definitely looking on getting a vaccine. And that has been worked on actively right now. Hopefully we could get that sooner rather than later.
And as we continue to see some states that have reopened dealing with record hospitalizations, what's your advice to Americans who are going back to restaurants, bars, and retail stores? Is it safe?
I would say it's definitely safe, but you cannot do it without taking some precautions. So as you see now, a lot of the restaurants, when you go, the seating is going to be different. There's a lot of outdoor seating that's taking place. You're going to see your servers wearing masks. There's going to be a lot of cleaning of the high-touch areas. It's just very different. And also, you want to make sure that you spend just a limited time. You don't just go there and hang out for the entire evening. You know, they're giving you like 90 minutes to 2 hours to be there at the restaurants and bars. And wash your hands, of course.
And also, a new COVID-19 outbreak is growing in Beijing, with more than 100 new cases reported in 29 different areas going on lockdown. And China, as you know, has had some of the most stringent restrictions in the world and still is having another outbreak. So what does this mean for the U.S.?
You know, we have always been concerned about a second wave that's coming, especially as we start to reopen. So we are concerned. So this is not something that's foreign to us. But what we need to do is to encourage everyone to wear their masks, continue to practice good hand hygiene, stay home if you're sick, and of course, practice social distancing until we get more definitive therapy to treat the COVID-19 infection.
Of course, summer officially starts on Saturday, and normally that would mean Americans are hopping on planes to scatter across the globe on various vacations. Do you feel like it's safe to fly right now? And beyond flying, what about public transportation?
I think right now, if you absolutely have to fly, you probably should. I think if you're planning some exotic vacation, I think you might want to delay that a bit. There are definitely certain steps that you're going to need to take when you're traveling now, especially on the plane, wearing your mask, making sure that you clean all the surfaces around you, the high-touch areas, the bathroom, you know, wash your hands more frequently. And, you know, now sitting on the plane, there has to be some spacing. So, you know, definitely, if you absolutely have to, go ahead. But of course, if it's not like a pleasure, if it's a pleasure trip, I would probably put it off. And again, the same thing applies to public transportation. You need to do what you have to do, take the precautions, and we hope for the best.
Some great tips and insight there, Dr. Wildes. We so appreciate you coming on.
All right. Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.